Hello, CAM followers. We are very honoured tonight. I've been looking forward to this for weeks, if not months. We have the amazing Professor Duncan Lascelles back, who's going to be talking about something that is really going to rock your core tonight, because osteoarthritis has always been linked to the older dog. And tonight we're really going to show you new data that is going to change your opinion on that. Before we start, I do want to say thank you to our awesome sponsor. Thank you so much, Big Barker, for always being there for us 2022. So the reason that we support Big Barker is because they actually did put their bid through a pilot study. And if you know CAM, you know that we want to give you evidence-based approaches to management. And the fact that this dog bed company took the time and the finances to put a little bit of a welly about their marketing claims really stands highly with us. So thank you very much, Big Barker. And now let's go on. Please, Duncan, tell us a little bit about yourself. Oh, let me put you away. So everybody can have loads of faith in what you say.
Well, I don't know that anything I say about myself is going to create that much faith in what I say, but I am a veterinarian. I'm a small animal surgeon. I work at North Carolina State University, where I've been for about 20 years. And ever since I've been here, and increasingly so over the years, I've built up a pain research program. And what that means is that predominantly we develop ways to measure pain in dogs and cats, primarily chronic pain, cancer pain, and then use those methods through clinical trials, clinical studies to determine what works to alleviate pain. I'm also very interested in, so all of my work hopefully is directed at improving clinical practice. And so as a practicing veterinarian, when I come across a problem, I look at that and think, well, how would we better understand that? What do we need to know to do a better job? And all my work is focused around pain management. And that's really what it's asking, those sorts of questions, that led me to question whether OA is an old dog disease, or whether maybe we should rethink our approach to OA in dogs.
So how did that start? Because as you say, it's got a real, everybody has a tendency to link it to the older dog, you know, the classic Labrador with the mane and the greying muzzle, and he's obviously got arthritis. That's why he's slowing down. There's nothing we can do. It's just inevitable. So did you kind of think to yourself, well, where does this start? And when do they first show their signs? What was it that triggered you to start doing more and more research about the younger dog?
Yeah, I think it was a couple of things, Hannah. So firstly, those older dogs, and on average, as a profession, we diagnose OA in dogs somewhere between 8 and 10 years of age. Those older dogs are actually really difficult to manage. That's why you and I and many others have spent so much time talking about multimodal approach and adjunctive drugs and what else can we do. We've spent time talking about that because they are difficult patients to manage. And then with my background, knowing that the longer you don't manage pain appropriately for, the more difficult it is to treat, and knowing from my orthopedic background that it is developmental disease in dogs, which is the primary driver of OA, I had to ask the question, well, is OA a young dog disease? Should we be looking earlier in life and seeing if we can manage them earlier on in order to make their futures better?
Absolutely. But I think, as you were just saying then, I was going back to my training at university, and at no point during the training in my first few years in clinical practice did I ever challenge myself, because we were so conditioned to accept it was an older dog disease and they would come in and you just manage them. There was no proactivity being taught about it. It was a reactivity to when you saw it, and you kind of almost patted yourself on the back if you detected it slightly early, when there just was a posture change or they struggled getting up, and you're like, yeah, hesitated to get into the car. You're like, oh, that must be a sign I'm so good. And now we're going leaps the other direction, which is really exciting. So let's jump straight in. You've been doing some amazing work that we really wanted to get the world to start listening to. Tell us about the projects you've been doing over there and scale.
Sure. Yeah. So what we what we did, and I have to credit Elanco Animal Health for funding this. I went to them and several other entities, and I said, look, I think we need to figure out when OA really takes off and how prevalent the disease of OA is, particularly in younger dogs, and whether or not that's associated with pain. When essentially trying to answer the questions, when is OA initiated? When does it become associated with pain? Should we sit back and say, no, this is an old dog disease, or is there a problem earlier on in life? So what we did is we went into a single practice, the small animal practice here at the university, which serves employees of the university, and we took all the dogs between 8 months and 4 years of age. Don't worry, Hannah, I'm not going to drag this out too long. I'm just going to
No,
give you a
I
little
like
summary.
it.
Going to give you a
I
little summary.
know. I
So
want it.
took all the dogs between 8 months of age and 4 years of age and grouped them into 4 equal age groups. So basically 8 to 18 months, 18 to 28, 28 to 38, 38 to 48. And so we've grouped these dogs into those age groups, then we've randomized the sequence in each group, and then we reach out to the owners and say, hey, would you come in for a health screen? So what we were trying to do was to get a random sample of this younger aged population. They came in, and what we did was we did full examinations, physical, orthopedic, neurological. Owners answered a lot of questions. We collected a lot of information, but importantly, we radiographed under sedation every joint in the body, so orthogonal views. And then myself and Masataka Enomoto, who really led the study on the floor, went through and we scored every radiograph, every joint, every radiograph. And where we disagreed on a score, we then came together and came to a consensus score. And what we
Just
were,
tell people how many radiographs per animal in the study that was, so they just have a concept of how big this is.
well, how many joints are there in a dog?
Upper elbow, shoulders.
1, 2, 3, 4. 4 fours are 16 plus the spine. So each dog has 16 joints plus, say, 4 segments of the spine, 20. And we ended up doing 123 dogs. So that's a lot of radiographs. Yes. Yes.
And
So
you did it independently, and
yes,
then you had time
independently.
together.
Then we came together and said, okay, let's compare every score for every joint. And if we disagreed, then what is one person seeing the other person's not, vice versa. So we end up with this consensus score, and what we've looked at first is just whether or not there was OA in any joints, any appendicular joints. So now we're just talking about the limb joints, and that those results were pretty surprising overall. And this is just this is now data saying, does a dog have radiographic OA in one or more joints? Overall, 41% of those young dogs had OA. That's just a yes, no. So that's kind of high, particularly when what we hear thrown around is this idea of 20% of all dogs have OA.
Yeah.
So 41%, that's high. But, and this is really important, and I hope we can clear up some confusion here. Having radiographic OA doesn't mean to say the joint's painful.
Yeah.
You and I, probably more me than you, have OA in joints that we're just not aware of,
Yeah.
because it's not painful. And so the next question was, well, how many of these joints are actually painful? And what we did with this is we said, okay, let's look at this in 2 ways, because we had every joint was evaluated by Masataka, and he put a pain score on it. And so, gentle, appropriate manipulation of each joint, do we elicit an aversive reaction? And essentially, we broke that down into mild, moderate, and severe. And so the first way we looked at the data was to say, okay, we've got 41% of dogs have OA, radiographic OA, in one or more appendicular joints. How many dogs both have radiographic OA and mild or greater pain? And remember, these are young dogs. And what we concluded was that just under 24% of these young dogs both have radiographic OA and mild or greater pain.
And were they definitely correlated? The mild radiographic OA was the same joint. Was that kind of? It wasn't that they had pain in a joint that didn't have OA and they had radiographic.
Right. So that 24% means that there had to be OA in that joint and pain.
Yeah, fine.
If they had OA in one joint and pain in another joint that didn't have OA, they weren't part of that 24%.
Right.
So then we got some feedback to say, yeah, but that's just mild pain. So we said, okay, all right, fine. Let's do moderate and greater pain. So the same thing. We looked at all the data, and if a dog had radiographic OA in a joint and then moderate or severe pain in the same joint, um, then those dogs we called clinical OA tier 2, uh, just under 17%.
That's crazy.
So so what we're talking about here is dogs between the ages of 8 months and 4 years of age. 17% of all those dogs had moderate or greater pain due to osteoarthritis in at least one
Mm.
joint. Um, and in fact, when we looked at the data in more detail, many dogs have bilateral OA and pain. A number of dogs had 3 or more joints affected. So this is a new concept here. Multi-joint OA is a real thing.
Yeah.
And so I think, what does this mean for us? It means that we now have data evidence to indicate that OA is a young dog disease.
Yeah.
It's initiated in young dogs, it's there, and it can be associated with pain.
Amazing. Because I remember talking to you 6 months, a year ago, I can't remember, and we were talking with the figure 37% of all dogs of all age categories. Where did that data come from compared to this?
Yeah, so we really haven't had great data on the prevalence of osteoarthritis, a disease, or the prevalence of clinical osteoarthritis, whereas, osteoarthritis and pain. And that 37% came from a study I was part of, actually run by Zoetis, where using checklists and applying OA checklists to dogs coming into the clinic, undiagnosed dogs, it turns out that about 37% of dogs coming into the clinic had positive signs of osteoarthritis pain. That was mainly in older dogs. And so I think there are two things that are going on here. One is that 20% of all dogs have OA pain is being moved up, that the figure is higher. And separately, we're looking at young dogs and saying, hey, osteoarthritis, the disease is there, and it can be associated with pain. So I think together the data are simply saying this is a more common condition than we thought.
Yeah, absolutely. And we need to really stop just connecting it with the older dog because we're missing massive opportunities to do something about it. Now, I'm going to say something really quite controversial now, but it is with the clinical OA. We've got the radiographic, we've got the clinical OA. Do you consider that radiographic OA is likely to lead into clinical OA? And when you see radiographic OA in that cohort that didn't have pain, is that still something that we should be vigilant about? Should there be some kind of screening? Should that be written into the clinical notes that is checked on a regular basis for when pain appears? Or should we be more proactive about it? What kind of thing does that suggest we should be doing?
Yeah, I'm not sure we have the answers to. It wasn't even that question; those questions that you posed there, Hannah. So, no, I don't think we have the answers. I think clearly, if there's no disease of OA, there will be no OA-associated pain. So there is a relationship there. But also, and we don't have good data on this, also, we know that not all OA, the disease, is going to be painful or is continually painful.
Yeah.
However, there are a few biomarkers that are starting to be uncovered that are predicting the development of pain in individuals with, call it, quiescent OA. So I think the future is that we will gradually get better at looking at an individual dog and saying, hey, this dog is likely to go on to develop pain. This dog is less likely to go on to develop pain. We're not quite there yet. So at the moment, I think, if we have detected the presence of the disease of OA,
Mm.
radiographic OA, but the joint is non-painful, we should be more vigilant with those dogs. We should be more proactive and instigate the sort of things that we know will make a difference to the progression of OA. And really, we're talking about caloric intake.
Yes.
So if we
Yeah.
have these young dogs and we have recognized as radiographic OA, I think, that is a very good reason to focus on caloric intake, decrease caloric intake, keep them a good body condition score, because there are great data to indicate that doing that will decrease the burden of OA, the disease, later on in life, which is likely then to decrease the burden of pain.
Yeah. Because this actually ties in. You've done work in all kind of sectors, like the stage 0 of coast.
Yep.
You've kind of gone this amazing journey, haven't you? Where you're the only person I know that's really gone, right, I want to get it before it even exists. I want to be there. So
Absolutely.
can you tell them about coast? Because I think I want this live to be really teaching people that we shouldn't be waiting. We shouldn't then be, yeah, it sounds all crying over spilt milk when our dog that's 8, 10 years old, he's now got really bad signs of AA, he's really suffering, and we've got very limited options. When we've now got so much material that could help us owners at a lot earlier stage make really sensible decisions. Like I grilled you earlier about your new puppy, didn't I? So
Yes.
did you do this? Did you look into the
Yes.
breed?
Right.
So tell me about the staging and coast work that you've done so people can realize that there's so much we can do.
Yeah, so I think the coast was born because we were trying to address a gap. The gap being there was no staging system for OA. People glibly talked about mild, moderate, severe OA. No one really had any idea of what someone else was talking about. So it was born from trying to address that. I mean, just as there's a staging system for kidney disease, the IRIS staging system. So we were trying to come up with a staging system, and then layered on top of that with the understanding, the realization that there are risk factors for OA, including developmental disease and obesity, possibly let's not go here today, but early neutering or early spaying.
Mm-hmm.
Um, and so the COAST staging tool both stages clinical OA, but also can stage dogs as you mentioned, 0 or 1. 0 means there's no pain, there's no indication of osteoarthritis associated pain, and no risk factors.
Yeah.
Stage 1 would be there's no osteoarthritis associated pain, but there are risk factors. The dog is obese, has a history of trauma. In the past, developmental joint disease was diagnosed. Maybe it's a large breed dog that was spayed very early. And so it really starts to talk about thinking about OA earlier on, identifying dogs at risk, and the next stage will be then proactively managing those dogs in order to decrease the burden of osteoarthritis associated pain later on. And that still needs a lot of work, a lot of information. We need to figure out how to actually do that. But the first stage is to recognize that OA is a young dog disease and recognize that even if OA pain is not present, there are risk factors for the development of OA, and pay more attention to those dogs.
Yeah. And sitting here as a first opinion practitioner, I just trying to work out how I could get that across to my owners. And that's something that I've been fascinated about for years, is
And
how do we make people sit up and listen?
yeah, and it's not easy, Hannah, because we are so we're so focused on OA being an old dog disease, and we're so used to only paying attention when it's an emergency.
Yes.
What I mean by that is if a large dog can't get up, that's an emergency. That really is an emergency. Everyone pays attention and does something about it. If dogs can't get into the car anymore, we pay attention. If they can't go up and down stairs, we pay attention. And we're so programmed to pay attention to those urgent situations, we overlook the fact that for years beforehand, and you mentioned it earlier on, these dogs have shown behavioral changes or adaptations as they try and cope with continuing to perform the activities of daily living. They try and cope with functioning in their environment, and they are showing us those adaptations. We're not paying attention.
No, we're not.
We only
And
pay
I don't,
attention when it's an emergency.
when it's an emergency. And I think so many memories are going back, because Cam's been going now since like 2015 and 16. And I can remember walking through a waiting room and seeing the classic black lab come in for a euthanasia, and he's there with his owners. And as I walked past with one of my colleagues, we both looked, and the empathy, the emotions come out. And I said, "Oh God," and she said, "It'll never change, Hannah. They will always come in too late." And I was like, "Oh, that's a little bit, no, come on." In my lifetime, I've seen a massive trend from people that have always had their dogs on like half choke chains and collars, and we now wear harnesses, and dogs are wearing coats. Of course, things can change. So that attitude made me kind of go, right. But I haven't had, like you've spanned the generations. I've kind of slowly stepped back, going, how can we get a little bit sooner, just a little bit sooner? But I always go back to shock tactics, as you say. A lot of Cam's approach to try and get people to sit up and listen is telling them the worst case scenario, to go, please listen, otherwise you're going to be there. And it still is hard work to get people to notice the early signs.
Well, it is, but I don't think we do ourselves any favors in our approach to it. So this is how the conversation could potentially go. Someone comes in with a 11, 12, 14-month-old puppy, and you see the signs of osteoarthritis pain. And so the conversation goes, "Oh, I'm so sorry. Your dog has osteoarthritis pain. It's an incurable lifelong disease that is associated with pain. And the treatment for it is non-steroidals. Here you go. Good luck." Now, that's kind of, that is what we're thinking. And if we verbalize that, well, that owner's walking out. They don't want anything more to do with us. That's not a conversation they want to hear, not a conversation we want to have. I would argue we flip that around and we make it positive. We say, "Oh, I'm so glad you came in today. This is, you know what? I think your dog has osteoarthritis pain, but here's the good news. If we take some steps now, we can actually improve your dog's future, and we can prevent." And then you go through
Absolutely.
the downsides of waiting
absolutely.
until
So
dogs are older.
I have to thank my friend Lindsay for this. She came up with one of Cam's key phrases, which is, arthritis isn't the end of the road, it's just the start of a new direction. And when Cam kind of started, as you say, because of the training that I had and what I'd seen in 10 years being a vet, was, oh, this is a bit dismal, isn't it? Oh God, I'm going to try scare tactics. I'm going to try and get people to do something by going, oh, it could end up like this if we don't do something about it. And actually, you're 100% right. By opening the door and giving people a positive pathway, I've found them engage more. But it is a balance. It is hard work. Some owners it works, some it doesn't. But
well, I think we, as I mentioned earlier, we don't have all the answers. What we need is, as a profession, and we need to figure out what early interventions really do work to alter the future. Now, I believe that we're starting to get some answers. I talked about caloric intake. I think appropriate exercise over a lifetime. I also think that managing pain aggressively and appropriately early on means you don't necessarily need to be managing pain lifelong. We have this mindset of, oh, I know non-steroidals work for pain, but I don't want to put this dog on non-steroidals for life. You don't have to. It's a matter of managing that pain at a young age, resetting the system, getting a healthier dog, a healthier nervous system, healthier musculoskeletal system, and you can then remove the drugs from that management regime.
Yeah, definitely. I don't want to critique my education 20 years ago.
Where did you... Well, Cambridge. Well, there you go. You see, you should have gone to Bristol. Should have gone to Bristol.
Okay. And here the war begins. No, but I can remember we got taught in a very typical way of the prevalence, the etiology, the clinical signs, the diagnostics, and then the treatment. And it stopped. And that's where it ended. And there was no follow-on in our clinical teaching of it's up and down and it's a curving pathway and you have to try different things. You've got to be objective. So I think there is a huge cohort of vets out there that go, well, once it's on non-steroidals, that's it. And
Yeah.
partly from a welfare aspect, because many of these dogs are brought into us quite well-developed pain states. And I think we as clinicians think, well, if they haven't seen the signs of pain earlier and we've got to here, then are we going to be in a good situation to try coming off the meds when they might go back into that pain state, and again they don't identify it, and again we go downhill? So I think it's not a simple solution. There's
It's not.
many
No.
confounding factors. But can you just use your amazing brain and teach people a little bit about the nervous system and pain? Because a lot of people are so totally convinced that once in pain, that's medication for life. What did you mean about rebooting the system?
Okay, that's great. In fact, I'm teaching a pain selective this week. We were talking about the students on talking to the students with the students on Monday about this. So, with if pain is not alleviated, those noxious signals that are interpreted as pain, going into the system will essentially cause it to deteriorate. Sensitivities increase, the system becomes more dysfunctional. You move towards what people are calling maladaptive pain, spontaneous pain, a situation that's very difficult to treat. What we should be talking about more is that those plastic changes, those changes can be bidirectional. So the
Right.
system can deteriorate, but if you stop those painful signals going in, essentially, if you treat pain, it gives the system an opportunity to reboot, to reset, to start to move back towards normal.
Yeah.
And once that happens, then you can back off on analgesic treatments.
Yeah.
So the changes in the nervous system can be bidirectional, and our management of pain should be adaptive over time. We should be constantly thinking about, or do we really need all these treatments now? Can we back off? Do we need to add treatments in, take them away?
Yeah, absolutely. And that is what we would love to be happening. But again, it is quite difficult because there's the client communication, there's the vet patient
Yeah.
relationship, and as you say, what would be lovely with every case come in, be able to educate them about pain, how it's, as you say, very adaptive, both negatively and positively, and multi-modal approach is needed. But we can fluctuate what we do depending on the animal's pain state. You can't do that in 15 minutes.
No, and that's I think that's one of the things that's really holding up this field is we need to figure out how to have these conversations with owners,
Yeah,
because you
absolutely.
can't fit it into 15 minutes when there's a bunch of other stuff to do. And so it's got to be a combination of the great education materials that you and your team are producing, being able to direct owners to to do some self-education and guiding that.
Yeah, absolutely. There's a trend over here. I don't know if you know that people are beginning to set up like MSK clinics. So not just a physiotherapy kind of rehab center, but there are a number of vets over here in the UK that are becoming really hugely focused on OA management, and they foresee in the next few years, decades, that OA management, articular joint disease management, is an entity in itself. It's going to be so busy. We've got so much of it on its way that they're not going to need to do anal glands and dentals. And do you think that with these prevalence figures that's a possibility?
I mean, honestly, Hannah, I think that I think osteoarthritis, degenerative joint disease, is probably the most common chronic disease of dogs and cats.
Mm.
And so given that, then it makes sense to put some emphasis around that, to focus on that, and to have these dedicated clinics. The intermediate step is generating information so that we know how to manage these patients at all stages of life and
Mm.
do it successfully, and convincing owners that this is worthwhile doing.
Yeah, definitely.
And those two go hand in hand. You can't stand in front of an owner and say, we have to manage osteoarthritis pain in your puppy, and then the owner says, well, what works? And you
Yeah.
turn around and say, well, we're not actually sure. We just need to know that we should do it.
But
Yeah.
even if we did know what works, there's going to be so much like phenotypic variation. You can't ever
Oh, sure,
guarantee.
sure. Yeah.
And I always say to people, nothing comes with a promise. The onus is on you looking for, I've seen this, I've done that intervention, I expect to change. And you've got to be seeing if there's going to be the change. And if there isn't, you've got to have the confidence.
And so that's something else that I'd like to just chat about
Yeah.
for a couple of minutes is osteoarthritis. The manifestation, behavioral manifestation of osteoarthritis pain in younger dogs is different to older dogs. We talked about in older dogs, we notice they can't get up, they can no longer climb the stairs. But in younger dogs, they're still climbing the stairs, they're
Yeah.
still getting up, they're still walking, still running, but they're showing adaptations. And so actually we all need to get educated on what those signs are and then pass that knowledge on to owners and say, you see that butt wiggle? Well, when your dog greets you at the door, the butt wiggle means one thing. When it's walking along and it has this butt wiggle, it could mean another.
Yeah,
It could mean that
definitely.
there's hip pain.
Yeah, definitely. And I sent you the piece because we've been doing a bit of work with Elanco as well, and I'm massive hats off to them for really putting a lot of time into this. And I'm just going to give the pharmaceutical companies a little bit of a high five. They get such a hard time, and it really frustrates me because they're the ones that are investing and coordinating and spending years collecting data to educate. It's well done, pharma companies. So we did a little bit of a client survey, a public survey with you guys, you can followers, and asked you about what were the first signs that you saw in your younger dog when diagnosed. So the only people allowed to complete the survey was same as you, 8 months, 4 years, that kind of category. And they came, the 10 categories that we kind of tried to distill out were gait changes, not necessarily lameness, but gait changes with the different ways that they moved. Changes with interactions with other dogs featured so highly. And that's probably because, that's when you're out observing your dog. You're in the park and you see how they behave with other dogs. You're a bit vigilant because sometimes they're on the lead, sometimes they're not. You're near roads. So your focus is on them. But that featured really highly. Changed interaction with people. So family members, friends, etc. Again, your focus is going to be on your dog. If you've got a guest coming in and the dog starts getting funny, you're like, oh God, so sorry. Changes in willingness to perform activities of daily living or requests. So sit, stay, wait, training started going out the window. Increased restlessness, so circling before laying down, getting up in the night, not seeming to get comfortable. Anxiety featured heavily. They seemed to become more anxious. And that could be that they wanted to be nearer you or they wanted to be further from you, but there was a state of arousal, a negative state of arousal. Some were overt behavior changes, so, dramatic changes in what was considered a normal behavior. So a really friendly dog becomes very unfriendly. Or resource guarding, where they'd been quite happy for you to play tuggy with a toy. They suddenly became very protective of that. Lack of ability to do things, so not just changed willingness, the actual inability to get in the back of the car. So rather than just going, I'd rather not, can I go over here? Actually, I'm going to try, but I can't actually do it. These two, panting and licking, featured a lot. And, that becomes, it's not pathognomic for OA, obviously not. But I think those sorts of things, that's really interesting. Dogs that on exercise normally would start panting quite well into the exercise, but would start panting before. Or even when dogs were sedentary, they'd be just unable to settle, kind of aroused and panting. And licking, now actually that's really close to my heart because my dog licked furniture. And she had lumbosacral disease and cervical disc disease. And she would compulsively lick and every, different patches of wetness on material. So I can relate to some of these. But I just think that's lovely. And now I'm going to do something really evil to you. Take away your professor hat. Take away the amazing Duncan Lascelles. You're just in the supermarket and you've bumped into your neighbour down the road who's just got a 14-month-old Labrador. And you see a few things or you hear in the conversation, how the heck? Because people don't link this with pain yet. And they feel that you're overstepping the mark. I have to be really clever of trying to work out how to broach the subject with the person that's coming for a vaccine. And I'm like, oh, how am I going to have that conversation with you? How do you do it? Do you have to, or does it not happen in your world at the moment?
No, it does happen. Yeah. And I think it's a difficult conversation to have. I mean, it really is. I mean, the way it happens most often with me is I go to a colleague and acquaintance's house or gathering, and they show the dog off. Oh, look, come and meet me a dog, and I see the signs, um, and I feel compelled to open up a conversation. But I think over the years I've learnt that if you come in too strong, you
Yeah.
make owners feel guilty,
Yes.
as if they're not good owners, if they're not good caretakers. Um, and so I think the best way is to you gently throw out that, hey, that might be a sign of some, and you can use words like
Yeah.
early joint pain, but then very quickly emphasize the benefit of paying attention to this now to prevent severe problems later on. But
Yeah.
always, and I'm always watching the individual, and you can see by facial expressions, have you gone too far? Back off, you
Yeah.
know, move forward a little bit, back off. And so I think those face-to-face interactions are very valuable if you can read people and you're just guiding them to a point where they will have a further conversation with you. You go in too strong, and that's too much. If you're too weak, you end up agreeing with them to ignore it.
Absolutely. It is
You know,
so
it is
complex.
difficult. It is difficult. And I think, this is where we desperately need more information to show that if we recognize this problem early on and if we instigate management, the future is better.
Absolutely. And I think there are ways that we could do that. And I can remember going to Crufts one day and there was the Discover Dogs where you learnt about the breed. So before you just picked a breed because it looked pretty, you actually learnt about the attributes of that breed. And within that, we really need to make people realise there are hereditary conditions, there are genetic predispositions, and you should be vigilant. If you choose to have that breed, be vigilant that this is a possibility. And I think you could then stretch that into like puppy socialization and initial health checks, is teaching people that this is a prevalent condition, and it doesn't make them a bad owner. But because we know that it's highly prevalent, we need to be vigilant to the first signs of it. So you've
Right.
got a 12-week-old pup that just come for their second vaccines, and you're doing an examination. You say, this breed is quite predisposed. I really want you to be vigilant to it. It doesn't make you a bad owner. It's nothing you've done wrong. But if we catch it early, so we do have opportunities as a veterinary team. Receptionists can get involved in that. Clinical displays, social media education via vet practices, nurses, vets. Because as you say, if you're the baddie, so no one said a word, and they've got this spanking new, he's 8 months old, and you go, "Oh, have you seen that?" You might as well leave the room. I've had a
Yes,
couple of
exactly.
people get upset with me, and as you say, you're like, "Oh God, I'm just trying to help," and it can put vets off actually even saying stuff, can't it? A bit
Yeah.
like the weight taboo topic.
Yeah. Very much.
Yeah. So any new vet students, I know a number of Duncan students listening, learn the skills of planting seeds in your puppy checks, in your vaccinations. Please, any breeders and dog trainers, your puppy socialization groups are an opportunity for you to talk about OA, breed predisposition, and how animals express pain. So that owner goes to the vet saying, I'm concerned, rather than what's happening where the vet has to try and tackle a really tricky topic in 15 minutes in a slippery floor in a small room with the computer facing the wrong direction so you can't even look at them.
Fantastic. Yes.
It's crazy, isn't it?
Yes. Yeah.
So just trying to give people, because a lot of people that are listening will be those that are proactive and want to take this information into the line of their work. So we have lots of canine professionals, but we're also going to have many followers who are living the situation. So they've got a dog with arthritis. What kind of sort of stuff can we kind of impart from your huge knowledge base? What sort of tips would you be giving them? And let's start with the thing that you're really passionate about is medication isn't for life. So around that area, what kind of tips can you give them to make that happen?
Yeah, I think the first tip is just listen to that phrase, medication isn't necessarily for life.
Mm.
And think about it, because that's absolutely true. And the reason it's true is what we talked about earlier on. A deteriorated situation can be reversed completely, partly. And once that happens, then you can start to remove the medication, decrease the dose, or even stop it altogether. So essentially, what we're talking about is take pain seriously. If it's there, treat it well. As you treat, the system, the body start to revert back towards normal, and you can then start to remove these treatments. And
Mm.
so fundamentally, if we can, I think it's good to try and embrace this idea of we're going to use effective analgesics, we're going to use lifestyle changes, manage pain appropriately, effectively, and then remove the drugs, continue with the lifestyle changes. And by lifestyle changes, I mean appropriate exercise, keeping dogs an appropriate body condition score, body weight, maybe modulating the diet to make it more anti-inflammatory. And those things are not easy to do. It's not easy for anyone to feed their beloved dog less. It is not easy with busy schedules to appropriately exercise dogs, but
No,
um,
and
it
changing routines. Routine change is
yeah,
so
but
difficult.
those will make such a difference later on in life.
Yeah,
And
no,
we come back to the fact that you can either ignore pain, leave it there, and then hope that things are not too desperate later on, or you can belly up to the bar, manage pain, instigate lifestyle style changes, and increase the longevity of your dog, increase its quality of life, particularly later on, have more time
yeah,
together.
definitely, definitely. So when you talk about lifestyle changes, because I just want to have
Mm,
the eminent Duncan Lascelles talk about things that people would consider fluffy, which
okay.
drives me crazy. So when you're talking to people about lifestyle changes, what kind of comes out your mouth? Because I'm renowned for talking about slippery floors, more rugs, less drugs. I've got a big hatred for tennis ball flingers, and all of that sort of. What's in your repertoire of advice, please?
Sure. But I think, when I'm talking about lifestyle changes, initially I'm really focused on diet, the amount of the caloric intake, and exercise.
Yeah.
You cannot overemphasize the benefits of exercise, not just for musculoskeletal system, but for cancer, diabetes, cardiovascular disease, and, it goes on, cognitive function.
Yeah.
Um, yeah, that's why I need to walk more. Um, so those are the lifestyle changes, and then I prefer to talk about you mentioned putting down runners, getting rid of slippery floors as environmental modification. And that maybe we should be doing. I should ask your opinion on this. Maybe we should be doing some of that earlier on to prevent injuries and earlier on in life, but certainly later on, get rid of those slippery floors, put down runners, help dogs move around in the environment. It's so distressing to me to see arthritic dogs come into our clinic and try and navigate the slippery floor,
Mm,
because what's happening is they're becoming more and more anxious. And I
yeah.
know from being in the pain research field that as anxiety increases, pain increases.
Yeah. Yeah.
Anxiety drives an increase in pain. If you treat anxiety, it actually has the opposite effect on pain. And so, if you think about that dog on the slippery floors, if they are becoming more anxious, more fearful, that's only going to heighten the problem, heighten pain.
Yeah,
So
definitely.
remove the slippery floors, remove the fear dogs have of navigating steps, moving around in their environment. And with that, you will be able to better manage pain because there'll be less pain to manage.
Yeah, definitely. I think I hope in my lifetime that we put these modifications not on par with pharmaceuticals, but if we are approaching the disease earlier, we are catching the signs of it earlier, we're not going to have to go in full guns blazing because we caught it really late. In many ways, they are on a par. You know, you're having the modified environment, the distraction, the exercise, the support harnesses, all of these sort of things. Instead of them just being shoved to the side and people going, oh, here's some drugs we'll see in 3 to 6 months, they actually have a really important role to play. And if I could get funding, I'd love to prove the benefit of environmental modification in comparative to, say, carprofen, you know, the standard comparative study, and just go, look, wow, come on, guys, it needs to be mentioned, because it does tend to get looked over. And there's almost like a little bit of owners come to the practice wanting you to talk about high-end interventions, drugs, intra-articular surgery. So when you talk to them about flooring, they almost go,
Yeah, and I was talking to the team of students today about exactly that, about not just focusing on drugs, but having on a par non-drug therapies. I think in many respects, it's more difficult to think through the non-drug therapies because there's a general lack of information and a lack of understanding of what works and how to instigate these changes and what changes are more important than others. But I think increasingly, I have to credit the behaviorists for this, increasingly as we better understand companion animal behavior, we are going to be enlightened as to the path forward for improving quality of life through managing behavior, managing behavior changes through non-drug therapies.
Yeah, definitely. And as you say about how behavior can influence pain and pain can influence behavior, it's a back and forth. You know, if we can keep these dogs in a positive mental state, distracted, engaged, you know, enriched, are we actually going to be able to influence their pain experience at that time and for a longevity afterwards? You know,
Absolutely.
you go out with your friends, you have a great night. You don't just stop having fun as soon as you leave. You're like, yeah, great night, you know, a couple of days after, you're still feeling good. So I just think that that's an area that's going to be really quite exciting.
Can you just go over that again? I missed that.
Well, the thing is,
You
I
have a
think,
night out with your friends, and then what?
and then for a few days after, you've had a great night with your friends. It's not that as soon as you get
Oh,
home,
I see. I see. You get the hangover, the positive effects
a
hangover.
positive hangover,
Yes. Okay.
if
A
there ever
positive
such
hangover
thing.
as opposed
But
to a
I think
negative.
I had a couple of challenging conversations with a few owners, and I hate to say it, males tend to be a bit more cynical. Women tend to be a bit more open to lifestyle changes, environmental modifications. And I was talking to an owner about using distractive, enriching, engaging tools. And he was like, well, as soon as I take it away, the benefit's gone. And he eats really quickly. So it's not, you know, it's only 5 minutes of pain relief. And I was like, no, it doesn't work like that. There's going to be a tail effect to it. And they're like, we need more data like that, because I think a lot of people feel it's strange, isn't it? A pill's very quick to give. Distraction and engagement is quite quick, but they do have a longevity effect. But that will come with time.
I think, one of the issues is, as a society, we are rather too focused on pills as a treatment for whatever ailment. And part of that is because we're lazy and we don't want to do some of the more difficult stuff, such as change our lifestyles.
Yeah, no, absolutely. I'd even go further than just pills, because pills gives this pharmaceutical. We seem to believe that things can be resolved by putting things in our mouth and swallowing them. You know, there's so much more than just feed the beast. You know, look at the environment that we're in, and I think things are changing. It's quite exciting. There's a lot.
But as you said earlier, these two things go hand in hand. The analgesics that we have access to are very useful because they work.
Yeah.
And they can help us then make those other changes, and those other changes can help decrease pain. And with decrease in pain, we can then remove the drugs. And so it's all a very positive cycle if we manage it correctly.
Definitely. Actually, you remind me, I wanted you to talk about your structure. So something that I find with owners is they don't like wishy-washy. They like structure. They like people with a confident plan. And if you've got a plan, I'm going to get behind you. I'm going to follow this. And so if I was to say we're going to go on anti-inflammatory and we're going to reassess in a few months and see how we are, they're like, But you actually have a little formula, which, yes, you modify and you bend, but it gives structure. What is your
The
formula?
3 plus 3. Yeah. So the 3 plus 3 months. And so, and it comes from exactly the experience you described. If you're wishy-washy and open-ended, well, what are we doing and for how long?
Yeah.
I think, everyone likes to have structure and a plan, know what plan A is, and know that there is a plan B to go to. So what I say to owners is that here's plan A.
Yeah.
And if plan A doesn't work, we'll go to plan B. I don't actually have a plan B, but I just need to get them on board with plan A because plan A does work. And plan A is essentially 3 plus 3, 3 plus 3 months. For the first 3 months, we're going to use an effective analgesic at the recommended administration protocol and doses and so on.
Mm.
We are going to optimize body weight. We are going to optimize exercise, which most cases means increasing exercise, adding in lead exercise. And then we're going to think about the diet. Can we make that more anti-inflammatory? Now, all of those things have many nuances and other details that we can tailor to the individual animal. But those are the fundamental areas we're working on for the first 3 months addressing. For the second 3 months, we plan to reduce or stop the analgesic, the drug,
Mm.
the pharmaceutical, the biologic. That's what we're planning on doing. But we keep those lifestyle changes, the diet, the body weight optimization, the exercise, we keep those going. And we're tinkering with those. We're trying to optimize those for that individual patient.
Yeah.
And then, I say up front, my goal is in 6 months to be able to take your pet off the analgesic drugs.
Yeah.
And I'll be able to do that. And that's why I then explain, because we would have made the whole system more healthy, the musculoskeletal system, the nervous system. And we can go on many months after that, maybe, even years without needing analgesics if we keep those lifestyle changes in place.
Yeah.
And so what happens when it all works is that owners see the benefit of that first 3 months, and then they're on board with the lifestyle changes because they're not looking forward to giving therapeutics for years.
Mm.
And I've told them up front that if they keep those lifestyle changes in place, we can minimize the need for those therapeutics.
Definitely.
And so it's
Yeah.
getting people on board with a plan, with a plan that has a finite end to it, so they can see, oh, there's going to be light at the end of the tunnel. And we also have to keep owners engaged. Everything I've described is not easy.
No.
And so you can't just say, well, here's a plan, good luck. You have to keep them engaged, which I think you mentioned earlier, these arthritis or MSK, which stands presumably for musculoskeletal. Yes, or over here, musculoskeletal clinics. And yeah, I mean, that's what we need, ways of keeping those owners engaged,
Nurse, clinic.
letting them know that they're part of the team.
Yeah,
It's not
absolutely.
us and them. They're actually part of the team, and we're relying on them as much as they're relying on us.
Yeah. Well, you'll be excited because we're making our first steps towards an app. We want to do an app because we really want owners to be regularly reminded and engaged and empowered and given tips and hints and advice. And, just like people go to Pinterest to get inspiration, we want it to pop up every day on the phone. That would just be really cool to keep them motivated for the changes that they've put in place. They've done the hard
Yeah,
work. You've
yeah,
already done it. Just keep doing it. But you find people drift back, don't they? The weight piles back on again.
yeah,
The amazing Alex German says 50% of cases that they hit target weight bounce straight back,
yeah.
because people fall off the wagon. So there is that typical human, keep them focused, keep them engaged. And it's a tricky. I love the fact that one of the most eminent people in the world, which is you, is so fascinated in the topic that I am, because that means that I'm not mad, because it's such a big topic,
I
isn't
do
it?
wish you'd stop saying the most eminent person in the world and all this. I just work in a tiny little area and I enjoy it, and I'm very happy to talk about it. I
You're
do
in.
want to mention one thing before we finish up here,
Mm.
and let me show you this. See that?
No, not
No?
yet. Let me
Oh,
go
hang
back.
on.
coming up. Here we go, add stream. It is now visible. You might not be able to see it, but I can see what you're doing with your dog in a grassy clump.
Yes. Isn't she beautiful?
She's very beautiful. How old?
7.5 months.
Aww.
Little Charlotte. All right. I'm sorry. I'll stop sharing. There you go.
I love it. I love it. Well, to be honest, guys, this has been one of the best lives. I just love it.
Hannah, you say that every time. Come on.
No, I would not say.
Yeah,
but before you go, quick fire 10 top tips to just remind people that, yes, we've got amazing technical advancements. We've got all of these new approaches coming into play, but the fundamentals still stand true. So give us some tips. You're going to do 10, I'll do 9, 8. So number 10 from you.
Now, these are not in importance order. These are just as I think of them. Everyone needs to understand this. Okay, and so we're talking about young dogs with OA here.
Yes.
All right. So the first one is acknowledge that OA is initiated early in life by developmental disease.
Perfect. Number 9 for me is do some research when you're looking at getting a pup. And even if you're doing something great and you're going to a rescue centre and you're taking on something that's got a little bit of age, still do some research. What are those breeds predisposed for? So you're alert and aware. Number 8.
Acknowledge and recognize that subtle changes in gait and movement are actually costing these young dogs a lot of energy, and they're only going to be expending energy if they're trying to avoid something meaningful. So the arched back, the butt wiggle, the odd way of going up and down stairs, those dogs are adapting. So remember that the signs of osteoarthritis associated pain in younger dogs are adaptations. They still perform the activities of daily living. Number 8 was a long one.
That's a good one. And piggybacking, number 7 is trying to get your observations in a coherent form to your veterinarian or your veterinary team can be quite difficult. So please take advantage of our suspicion of chronic pain PDF, which Lynn will put on here, which just allows you to allocate your thoughts, and then you can present it in that time limited consultation. Say, I've seen this, I've seen that, I've seen the other, and I'm having a little bit concerned there might be something underneath it. So present it well to your veterinary team. 6
related to that is video from the home environment is incredibly useful to your veterinarian. So consider getting reasonable video, good lighting of your pet moving around in its environment at home, because that is information that otherwise we as veterinarians just don't have any access to, and it's incredibly informative.
Love that one. Number 5, I'm going to steal the biggie, weight control from a young age. We know that overweight puppies will lead to overweight adults. So I was brought up with my mum going, oh, you grow out and then you grow up, you grow out and then you grow up. Does not apply. By keeping your dog at the right body condition score as a juvenile, you are going to pave the way, hopefully, for them to keep the right body weight as an adult. Number 4.
Remember the value of exercise, and it doesn't have to be fancy movement, just walking. Yes. So useful to maintain a healthy musculoskeletal system, and it has health benefits across the whole body.
I love it. Number 3, I'm a massive advocate for our allied professionals. What I've learned from physiotherapists with touch and trying to figure out asymmetries and coat patterns and what things feel like. Don't be shy of looking to the allied professionals that are connected or advocated by your practice to do a full checkover. Number 2.
And on that note, or related to that, then this is for the veterinarians tuning in. Empower and listen to your staff. Empower them to lead these osteoarthritis management clinics, and listen to their feedback.
That's a lovely one. I'm going to sting you in number 1 as well.
Number one's easy, and this is my number 1. Be positive. Be positive about all of these discussions, because as soon as we revert to that negative overlay with osteoarthritis, it becomes something that no one wants to talk about, no one wants to address, no one wants to admit to. I'm looking forward to the day when I go along to a cocktail party and instead of someone showing off their dog, they say, look at my dog, and I found out it has osteoarthritis. I now know how to manage it and improve its future.
Yeah, no, absolutely. I had a colleague once say to me, "You still interested in arthritis? So boring, Hannah." I was like, "Oh my God." It's far from. It's an expanding field that's making massive leaps and bounds. It's fab. Thank you so much. And I'm sure that everybody that's been listening will say thank you. It is an absolute pleasure to have you back again. If anybody wants to see the recording, it will be on our Facebook stream for a period of time. It will be in our YouTube for a period of time. So please do share this. Let's get the message out there. Thank you, Duncan. I know you've got to go back to work. And take care, followers. We'll see you next week.
The pleasure was mine, Hannah. Thanks very much. Bye, guys.
Bye.